Back on the Chad Hasty Show, News Talk KFYO. Thank you for joining us this morning. Our next guest joining us on the phones, the Deputy Secretary for the U.S. Department of Health and Human Services, someone who has been very, very busy over the last month especially. Deputy Secretary Eric Hargan joining us here on the Chad Hasty Show. Secretary Hargan, welcome to the show. Thank you for joining us today.
Thank you, and good morning.
Let's talk about where we're at right now as far as testing goes for the coronavirus. Where did we start, and where are we at right now as far as testing and what the Department of Health and Human Services has been doing?
So, where we started was that we had a new virus that was introduced into the U.S. So, as you may remember, it was originally called the novel coronavirus, meaning the new one. So we have moved from a full stop at the beginning where we had no tests at all and really nothing to analyze a new virus that was being introduced to now we've had 2.5 million cumulative tests done in the United States, by far the largest number done worldwide of any country. I mean, by leaps and bounds. About 150,000 tests are being done each day. And we expect that number to rise pretty quickly. We have 30 emergency use authorizations for new diagnostic tests that FDA has approved. So we got, and we have a number of different kinds, from point-of-care diagnostics to sort of the lab tests that can do thousands a day. This is between the private industry side, hospital-based labs, public health labs, and so on. Everybody's kind of animating to get more and more testing done from what was originally, again, developing a new test, getting it, and having 30 tests approved at this point.
How impressed have you been at, and you could say it's part of the American spirit, I think, that all these businesses have really sort of come together to help out and do their part. You look at the Abbott test that is getting rolled out in different states, including here in Texas, and just different ways of getting those tests and face masks and protective gear out. It just seems like so many businesses across the nation are doing their part to help out.
It is fantastic. So it is the testing companies, but it's really every part of America that is working on this. And I mean, private industry has stepped up magnificently. And, both from the point of view of bringing us now, we have 10 different therapeutic agents in active trials, 15 more planning for clinical trials right now. And those are basically things that can help cure or mitigate the disease if you get it. And so we got 25 of those in the hopper right now with FDA. We've got 2 vaccines in trials right now. A second one came in earlier this week, or maybe late last week. We had already 1 vaccine in place and then another one on the way. We've got, as I said, 30 different tests coming forward, and that's in addition to everyone who has been stepping forward with existing products, whether it's beds, ventilators, masks, so on, that have come forward. We got tens of millions of doses of chloroquine, hydroxychloroquine that were donated into the stockpile for distribution. We've got everybody who has helped produce all kinds of equipment and medicines that have been brought forward. It is a fantastic response, especially people coming up creatively to be able to bring forward new things, like, for example, sterilizing the masks. That wasn't even a possibility before. We moved from really a call I got on March 20th from a hospital CEO who said, we got a company that can sterilize masks. They hadn't had it been approved by the FDA. Within 24 hours, I had them in front of FDA, and 9 days later, we have them preparing sterilization chambers and being able to sterilize masks for up to 20 reuses, which really extends the amount of production that we're able to do here in the United States, because now we got basically those masks, not just one use, but 20. And they're not the only one. So the amount of creativity and effort that's been put into this by companies, by state and local leaders, and also by individuals who are working themselves, social distancing, practicing basic hygiene. That's why we've seen these numbers coming down nationally.
We have a lot of people in this area who are itching to get back to work and get their small businesses up and running. Oh, looks like we lost him. Oh, well, we'll see if he can give us a call back. The Deputy Secretary of the U.S. Department of Health and Human Services. Let's do this, Rob. Let's run the break. When we come back, or is that him? Is he back? Okay, good. All right, just like that. We're back with Eric Hargan here on the Chad Hasty Show. Glad to have you back on. We've got a lot of people who want to get their businesses back up and running, right, and want to get back to work. What's your message to those folks?
Well, I think that, we're here at HHS, we're Health and Human Services, and we provide the best medical and scientific advice that we can to the president. But the president is the president of the whole country. He's not the president of HHS, right, and we understand that. We give him what advice we can through our doctors and our scientists. But ultimately, he's going to be making a decision based on those factors, the economic factors, the social factors, and the healthcare factors that affect this country so strongly. And so, we all have our part to play here in the federal government. So, we look forward to that. There are obviously consequences all along the line for the country with the persistence of this. The president's been focused on, the lives of the American people, making sure that we, reduce the impact of this new disease on us. But obviously there's a balancing act that has to take place, and everybody is going to give them the best judgment that they can.
Health-wise, what would you tell business owners to keep people safe? Like, let's say we're, 2 months from now, and the president decides we're going to have, different businesses reopen. Health-wise, how can people keep their customers safe?
Well, we have a lot of guidance out there on the CDC website right now. So people who are working in critical infrastructure, they already have their workers in place. And so you look at a lot of things people are staying at work, not just healthcare workers, but, there's utilities are running, the water companies are running, sewage is being disposed of. There's a lot of critical infrastructure that's in place that's staying open right now. And we have guidance out there on those workers, whether it's people working in grocery stores, pharmacies, retail businesses, and then critical infrastructure. So we've already got some guidance out there. I think the question is going to be what guidance further that we're going to be working with state and local governments on. Remember, crucially, it's the states and the localities that are by and large imposing the restrictions on businesses and on social activities at the local level.
Right.
So the question is going to be whether we're going to work with them on guidance to get to them about how they can carefully and thoughtfully start reopening parts of their own areas when that is appropriate, and try to say exactly how that would be appropriate for them, what they should be paying attention to. Those are the kind of guidance we can give them from the federal government, because we don't impose those kinds of rules at a national level, right, across the entire country in the same exact way.
Right.
We've got a big continent-sized country.
Yeah, absolutely. We appreciate the work all you guys are doing, and stay healthy, and hopefully we'll visit with you again in the near future.
Yep, stay safe, stay healthy, and follow those guidelines.
All right, sounds great. That's the Deputy Secretary for the U.S. Department of Health and Human Services, Eric Hargan, here on the Chad Hasty Show. We'll run the break. When we come back, your phone calls, your text messages, and more.